Hello everyone, myself Lisha George from College of Physiotherapy, Meerut, Maharashtra. I am here to explain on topic lumbar region and some exercises on spine stability and core strengthening. So let's get started. So here we are with the lumbar vertebrae. So firstly we're going to study the structure and the function. In that we'll be studying about the biomechanics, about the kinematics and the kinetics. Then we'll be having the pathomechanics and ergonomics, and they'll be followed by some exercises from lumbar rotation. The structure. The body is massive. The transverse diameter is larger than the anterior diameter and height. And the support has the lumbar vertebrae is the biggest. So the compression load is mostly on the lumbar vertebrae because of the body. And the pedicles. They are short, thick and projects posterolaterally. Laminae as they are short and broad. Transverse process, long, slender, extends horizontally. Then we have the accessory process. Small irregular bones located on posterior surface of the transverse process near its attachment to the pedicles. Also the accessory processes are the sites where the attachment of multifidus. Then we have the spinous process, which are broad, thick and extends horizontally. Mammillary processes located in the posterior edge of each superior zygaprophyseal facet. Attachment sites for the multifidus as well in here. Zygaprophyseal articular processes. So these are facets which are superior and inferior, vary in shape and orientation. The vertebral foramen of the lumbar are mostly triangular, larger than the thoracic vertebral foramen, but smaller than the cervical vertebral foramen. So, fifth lumbar vertebrae is the atypical vertebrae. It is a transitional vertebrae, wedge-shaped body. Superior discal surface area is 5% greater than all the other vertebrae. Inferior discal surface area. Spinous process is smaller and directed superiorly. Intervertebral disc. As we all know, the lumbar vertebrae has the larger intervertebral disc. The collagen fibers of annulus fibrosus are arranged in sheath called lamellae. The concentrated rings surrounding the nucleus resist the tensile force in nearly all directions. The shape of each disc is not purely elliptical but concave posteriorly. As you all can see, it is concave posteriorly. Provides greater cross-section area. The articulation. The interbody joints. They are capable of translating and slits in all direction. The zygaprophyseal articulation or joints. They are true synovial joints. Then the fibroadipose meniscoid structures. Then we have the facet joint, which has a capsule resists the axial rotation, the resistance to anterior shear. Then we have lumbosacral articulation. It's nothing but the fifth lumbar vertebrae and the first sacral segment. So, okay, the first sacral segment is inclined slightly anteriorly and inferiorly, forms an angle with horizontal. That's called the lumbosacral angle. So here you can see the lumbosacral angle. The increase in the angle is called as the increase in the lumbar lordosis and the increase shearing stress at lumbosacral joints. So the ligaments. The first ligament is here, the supraspinous ligament, which are well developed only in the upper lumbar region. Most common termination site will be the L4, or maybe in some cases it will be L3. Transverse ligament are which are the not true ligaments in lumbar area and are replaced in the iliolumbar ligaments at L4. The other is the interspinous ligament, has least overall stiffness and joint capsule the highest. Then we have the anterior longitudinal ligament, which is very strong and well developed in this region. Then the posterior longitudinal ligament is only a just thin ribbon in lumbar region, whereas the ligamentum flavium is thickened here. Ligamentum flavum, which are paired ligaments which run between the adjacent laminae of the vertebral body and are present from C2 to 3 to the sacrum. Then we have the iliolumbar ligaments. The series of band extends from tip and borders of transverse processes of L4 and 5 attached bilaterally in iliac crust of pelvis. They have 3 bands, mostly the ventral, dorsal and the sacral. So here we have the ligaments and its function. So the anterior longitudinal ligament, its function is to limit the extension. Then the posterior longitudinal ligament, the ligamentum flavum, supraspinous ligament, interspinous ligament. These are the ligaments which limits the forward flexion. The intertransverse ligament has it limits the lateral flexion, and the iliolumbar ligament they resist the anterior sliding of till the L5 and S1. So muscles, the next topic, the posterior muscles. It's the thoracolumbar fascia. They are divided into 3: the posterior, middle, and the anterior. The posterior, which is the large, thick, arises from the spinous process and the supraspinous ligament of the thoracic, lumbar, and the sacral spines. They also give rise to the internal and the external abdominal oblique and the transverse abdominis. In the anterior, they are the active part of contraction of transversus abdominis muscles. Then we have the erector spinae. Each muscles are having the lumbar position. Primary extensors of the lumbar region when acting bilaterally. Acting unilaterally, they are able to laterally flex trunk and contribute to rotation. Multifidus muscle. Because of this muscle, multifidus, the line of pull in the lumbar region is more vertical. It has a greater cross-section area, produces the lumbar extension, add compressive load to posterior aspects of the interbody joints. Then the lateral muscle, the quadratus lumborum. These are deep to the erector spinae and the multifidus, acting unilaterally. Laterally, they flex spine and control the rotational motion. Then we have the anterior muscles, mostly it's about the rectus abdominis. They are the prime flexor of trunk, provide stability in corset type of manner across the trunk. These fascia connection transmit force across the midline and across trunk. Abdominal wall, the external oblique, internal oblique, and the transversus abdominis muscle. So these are the abdominal wall. So then we have the psoas major, runs from lumbar transverse processes anteriorly, the vertebral bodies of L12 to L4. The distal tendon merges with that to the iliacus. The kinematics. Lumbar movements which are available are flexion, extension, lateral flexion, and rotation. Gliding, it happens anterior to posterior, medial to lateral, and torsional. Tilt, it happens anterior to posterior and also lateral direction. Lumbar flexion. Lumbar flexion is more limited than extension. Maximum movement at lumbosacral joint, anterior tilting and gliding of superior vertebral occurs. Increased diameter of intervertebral foramina. The flexion generates compression force on anterior side of disc tending to migrate nuclear pulposus posteriorly. Lumbar extension there is an increase in lumbar lordosis, posterior tilting, gliding of superior vertebrae. Lumbar extension reduces the diameter of the intervertebral foramen. Fewer ligaments checks extension. During lumbar extension, nuclear pulposus displaces anteriorly. In lumbar lateral flexion, the superior vertebrae laterally tilts, rotates, and translates over vertebrae below. Annual fibrosis is compressed on concavity of curve and stretched on convex side. Nuclear pulposus migrate slightly towards convex side of bend. Then we have the rotation. Rotation causes movement of vertebral arch in opposite direction. Ipsilateral facet joints go for grasping and contralateral facet joints for impaction. Rotation is limited, one of the reasons, because due to the shape of the zygapophyseal joints, also restricted by tension created in stretched capsules of joints and stretched fibers. Amount of rotation available at each vertebral level is affected by position of lumbar spine. The lumbo-pelvic rhythm. The kinematic relation between the lumbar spine and the hip joints during the sagittal plane movements. When we bend forward, the lumbar flexion is 40 degree, followed by the anterior tilting of pelvis at hip joint will be around 70 degree. Return to erect posterior tilting at pelvis at hip, followed by the extension of lumbar spine. Integration of motion of pelvis about hip joints with motion of vertebral column, which increases the range of motion available to total column, reduces amount of flexibility required for the lumbar region. Then we have the hip motion. Eliminates need for full lumbar flexion, protecting the annulus fibrosus and the posterior ligaments from being fully lengthened. So the next topic is the kinetics. Here we have the compression. Lumbar region produce support for weight of the upper part of the body in static as well as in the dynamic situation. The lumbar region also withstand the tremendous compression loads produced by the muscle contraction. The change in the position of body will change the location of the line of gravity, and thus the change forces acting on the lumbar spine. The lumbar interbody joints share 80% of load, and because of that, the zygapophyseal facet joint in axial compression shares 20% of the total load. Also, this degeneration of intervertebral disc, the zygoprophyseal joint will assume increased compression load. Then we have the next topic, the shear. Shear. In upright sitting position, lumbar segments are subjected to anterior shear force caused by the lordotic position, body weight, ground reaction forces, resisted by the direct impaction of inferior zygoprophyseal facet of the superior vertebra against the inferior of adjacent vertebrae below. So here we can see the shear is mostly it is horizontal, the compression is vertical. The pathomechanics. So here we have the first, that is the sway back. Sway back increased lordotic curve and kyphosis. Because of this, it has a weak lower abdominals, the lower thoracic extensors, and the hip flexors. It has a tight hip extensors, the lower lumbar extensors, and the upper abdominalis. And then next is the exaggerated lordosis. It is because of the abnormal exaggeration of the lumbar curve. It weakens the abdominal muscles. Because of this, we have the tight hip flexors, the tensor fascia lata, and deep lumbar extensors. Because of this lordosis, there is an increased compressive stress on the posterior elements, which give because of this we are predisposing to the lower back pain. And there is also another phenomena called the flat back posture. They are they relatively decrease in. They have a decrease in the lumbar lordosis by 20 degree, and the center of gravity shifts anteriorly to the lumbar spine and hips. PIBD, intervertebral disc prolapse. So as we all know, there is a disc between the vertebrae. So these are made up of jelly-like material. So they consist of three distinct components, which are known as the cartilage end plates, nuclear pulposus, and the annulus fibrosus. So PIBD occurs due to this jelly-like substance. This disc get pushed out. So when this happens, there is a they increases the pressure in the spinal cord, and it accompanies the nerve roots, which is very painful. There are 4 stages: the bulging, the prolapse, the extrusion, and the sexutation. So this is the sparse articularis fracture, and this the region between the superior and the inferior articular surface get fractured. So it is the weakest bone posture of a vertebral neutral arch. So here I'm going to differentiate these 3. The first one is the spondylosis. Spondylosis is also known as the spinal arthritis in common, respect to the age-related condition that affects the joints and discs in your neck and back. And then we have the spondylitis. It is an inflammation of any of the joints between the vertebrae of the spine. These may occur in osteoarthritis, rheumatoid arthritis, or more specifically in ankylosing spondylitis. Then we have the spondylolisthesis. Spondylolisthesis is the condition of spine in which forward displacement of one of the lower lumbar over the lumbar below it. It is basically the displacement. So the next topic is the ergonomics. It is basically the tip for the mechanical backache. So we are going to discuss how we can reduce this pain or we can prevent. So first you'll have to sit in a proper position while sitting in the chair. Should be upright sitting with a head straight. So here it is clearly written the motion is medicine. So while people are working for 1.5 hour, it gets the muscles get very stiffened and rigid. So you all can really just get up and walk around. That's all about the motion is medicine. Then sit, stand, workstation. So if you are very tired of sitting in a chair, you all can get up and sit on the table or walk around or sit on some other surfaces which are very much comfortable. Then we have already discussed about the posture. Then it is about the ergonomic chair. There are various type of ergonomic chair available in the market which really has a lumbar support so that y'all can really sit erect and y'all can do your work comfortably. So whether you are pushing a grocery cart or putting on shoes, you use your core to accomplish everyday activities. It also affects your balance, posture, and stability. Contrary to the popular belief, the core does not just include the abdominal muscles. It also consists of muscles in your back and around your pelvis. Your core includes muscles like the rectus spinae, rectus abdominis, obliques, which are the internal and the external oblique, transverse abdominis, and multifidus. Keeping these muscles strong helps to stabilize your body, support your spine, and enhance your overall fitness. If you are new to exercise or if you haven't exercised in for a long time, start with these beginner moves. So the first exercise is the bridge. Start on your back, bend your knees and plant your foot on the floor at hip width. Place your hands at your side, palms down. Tighten your cores and glutes. Raise your hips until your knees are in line with your shoulders. Hold it for 10 to 30 seconds. If needed, you can have repetitions. So the second one is crunches. Crunches are the classic core strengthening move. The act of lifting your upper body works on abdominal muscles. If you have lower back pain, do the crunches with care. Move slowly and start with just a repetition. So like this, you all can have one set of 8 to 12 repetitions. So the next exercise is the plank. Plank is a full body exercise that targets your core. It also strengthens your arms, shoulders, back, glutes and legs. So if you're a beginner, try it to hold it for a longer seconds. To make this exercise easier, place your knees on the floor. Supine toe tap. The supine toe tap is a basic Pilates exercise. It encourages your core muscles while working your glutes, hips and legs. It also places minimal pressure on your spine. If you have back pain, the toe taps may be an ideal alternative to crunches. Start on your back, lift your legs, knees, bend to 90 degree. Place your hand at your side, palms down. Tighten your core, lower your right foot and gently tap the floor. Keeping your left leg still and your back flat. Raise your right leg to return to the starting position. Repeat with your left leg. Start with one set of 8 to 12 repetitions. Next, we have the mountain climber. It is a combination of plank with knee movements. So it is an excellent move for balance and core strength. Start in the plank with your hands below your shoulders. Tighten your core, Lift your right knees towards your chest and keep your back straight and hips down. Return your right leg to the starting position as you simultaneously lift your left knee towards your chest. Continue alternating legs. Start with one set of repetitions like 8 to 12 repetitions. The warrior crunch. This crunch variation works your core, your lower body, includes your thighs, glutes and quads. Stand with your feet slightly wider than shoulder width and your toes turned outwards. Put your hands behind your head and open your chest. Tighten your core and glutes. Bend your knees until your thighs are parallel to the ground. Bend your torso to the side, moving your right elbow towards your right thigh. Repeat on the left side. Start with one set of 8 to 12 repetitions. So now if you are mastered in the above said moves, challenge yourself to an advanced core routine. These exercises will further build core strength by engaging your muscles in more complex way. This is called the side plank with rotation. This exercise is an advanced version of basic plank. It strengthens the arms, the shoulder and obliques by combining a side plank with arm movements. Lie on your right side with your right forearm below your shoulders. Extend your legs, left foot on top of right. Tighten your core. Lift your hips to form a straight line with your body. Raise your left arm straight up. Rotate your torso towards the floor and bring your left arm under your body. Rotate your torso and straighten your left arm to return to the starting position. Start with one set of 8 to 12 repetitions. Repeat on the other side as well. So finally we have come to an end of this topic. Hoping that it helped you all and thanking you all for providing this opportunity in such a platform. And once again, thank you.